everyone, and welcome back to the Non-Traditional Nurse Podcast. Today, I'm joined by Andrew. Thanks so much for joining us today, Andrew.
Yeah, thank you for having me. I appreciate it.
So, Andrew has worked in several non-traditional roles, including as a travel nurse and recruiter, but today he's going to be sharing his experience with being a nurse in a correctional facility. And I'm super excited because I feel that it's just a misunderstood path in nursing, really.
Oh, totally. I haven't really seen anyone on social media talk about corrections. It's when I was a recruiter, I'd run into corrections nurses, and they were always really happy, which was surprising. And so, yeah, happy to share my experience with working in a jail.
Sweet. So let's start at the beginning. And
Yeah.
can you just give us kind of a brief overview of your nursing journey and how you ended up in corrections?
Yes. I feel like my journey in nursing is about as non-traditional as it gets. Yeah, my pathway has gone all over the place. I mean, if you looked at my LinkedIn, you can see I've just done a ton of stuff. But
Yeah.
been a nurse since 2012. Most of my time was in acute care as a traveler, in step down. But when you're a traveler, you get floated everywhere. So never really felt like I had a home. I was more like a float all the time. Prior to acute care, I worked in nursing homes and skilled nursing facilities. After my wife and I got married, we got back from Scotland and we're like, this is, we got to get out of here. We had the travel bug, and that's how we got into traveling. And then my wife's a nurse as well. I'm
Oh,
not sure if I shared that with you, but we traveled for several years. I kind of, got tired of nursing for all the reasons you hear about on social media, burnt out. And I was looking for a change, and that was towards the height of COVID. And I had a friend that was a recruiter, hit her up, picked her brain. She was a former nurse, and then ended up getting into recruiting. And I recruited for about 4 years. And then being completely away from the bedside up until this year, actually, um, found myself back in the bedside after variety of challenges in life, and then I found the job on Facebook in a Facebook group, and so I work at a Black Hawk County Jail in Waterloo, Iowa.
okay. And tell us, when you saw that job posting,
Mhm.
or maybe when you brought it up to your wife, what's your first initial reaction to the idea of working in a correctional facility? Like, did you have hesitations or what
Oh
that look
yeah,
like?
totally insane. Yes, my wife. The very first thing that my wife said was, "There's no way you're working in a jail." Um, that took some convincing. I was curious though, because like I mentioned, every corrections nurse I've ever talked to was really happy. And that's, I mean, rare in nursing where nurses are happy in their job. And so that was appealing. And then I just said, well, let me just do the interview. And so I remember on that first moment about to walk into a jail, I'm like, God, I've never been inside one of these before. What is this going to be like? And so, yeah, ultimately the interview went really well, and I got the offer a couple days later. And since then, my wife has settled down a little bit. I think people are just really freaked out about the safety element. And
Absolutely.
truthfully, there are a lot of facilities out there where nurses, we don't have to wear them at this facility, but at max facilities, you'll wear guards around your neck, like they're called like stab protectors. They're the total thing. But if you've ever heard the phrase like working in the jail is safer than working in the ER at the hospital, I 100% believe that,
Wow.
because there are, you know, dozens of officers everywhere. So the safety element is not really a concern at all these days.
Yeah. And safety, I think, is probably the biggest one that we think
Yeah.
of when we think of like the stigma of working in,
Hmm.
those areas. Are there any other misconceptions you feel like about providing care in corrections that you have debunked or anything like that?
Yeah, I mean, there's a few. Just like with anything, what you see on TV is not at all what it's like actually working inside of a jail. You have a lot of preconceived notions from movies, from television, about what it's like to work with sheriffs and police officers, as well as um, with the patients. We refer to them as patients. On the custody side, they'll refer to them as inmates, and so you really have a lot of false information in your head from those experiences. So that's one thing, is like basically everything on TV is wrong about it.
Yeah.
Shocker.
Yeah.
Um, I would say, we can do a lot of good for people in a jail, surprisingly. Those people are, um, they've fallen through the cracks. They've burned bridges. They're in a lot of legal trouble, or potentially. And so it's a really satisfying position to be in. I was thinking about our talk that we were going to have. And one of the things that I really enjoy about it is you know, I see a lot of myself in these people, because I think we have all had struggles in life. And so when I get to show up for these people, it feels really good,
Yeah.
because a lot of these people have given up on them, their family or friends, and some for good reason, of course. But yeah, the safety thing is huge. People really think that your life is in jeopardy every time you go in there. In theory, that is, I guess, true, because you're dealing with people that can be dangerous, but it's such a rare occurrence that I feel unsafe in there.
Yeah, I'm glad you brought that up too. I mean, so many nurses love like treating vulnerable populations, and truly this is like one of the most vulnerable
Mhm.
populations in my opinion, And
Definitely.
I actually wanted to be in corrections and I couldn't get a job as a nurse practitioner because people really wanted to work there when I was living in Colorado. So I had talked to a few of them and they said something very similar that, as their provider or their
Yes.
nurse, you're able to treat them kind of like a human where they don't
Mhm.
necessarily get that every day, which is it's pretty sad.
Yes, and in a place that feels dehumanizing, I mean,
Mhm.
you're stripped of your independence and freedoms in a correctional environment, and so when you're kind of like a little bit of a light in a place that can feel really, really dark, um, and so that feels really cool,
Yeah,
to
absolutely.
be those types of people showing up for people in those places.
That's awesome.
Mhm.
So can you talk about what your typical day might look like?
Yeah. This is gonna vary so significantly from jail to prison or correctional facility, but ours is, around 300 beds. And so any given day, there's probably 2 to 3 nurses on days and a couple on nights. And so the first portion of your day is med pass, which lasts about 3 hours. You're passing meds to maybe, I don't know, 75 to 100 people. And that is like, to an acute care nurse, so they'd probably be like, holy shit, I'm going to have a heart attack. That's
Yeah.
insane. Those ratios, oh my God. Um, but you have to think about the acuity level of these people. This is kind of like a mixture between primary care, long term care with a sprinkle of ER urgent care, because these people are really sick and they just don't take care of their health. So they
Mhm.
can be pretty unstable. They're coming in right off the street.
Yeah,
So,
absolutely.
but because people stay, that I guess that's another preconceived notion, is like people stay in jail a lot longer than you think. Sometimes up to a year, maybe even longer, waiting for the case to work its way through the system. And so you end up becoming these primary care providers for these people, essentially. So first part of the day is meds. Then the rest is like handling issues, sick calls that come through. Hey, my finger hurts, my back hurts. I've got this weird drainage coming out of this place, or oh, I have chest pain. Surprise you, getting people down there for cardiac events. And then a lot of detoxers. So you're handling that. You deal with folks on every drug imaginable. And so you're helping them come down from that. Detox is extremely common in jails.
Yeah.
Um, and then what else? A lot of education. You're talking to these people about their health and, helping them maintain their health as best as you can in a jail environment. There's, nutrition's limited in the sense of like variety. Of course, they get 3 meals a day. They've got commissary, which is they can put in little orders to get various goods from the website. But the nutrition isn't really fancy in a jail, of course.
Yeah.
What else? A lot of coordination with outpatient facilities, I would say. So these people they have cardiac issues, ortho, a lot of pregnant patients. That was probably the biggest surprise, I'd say, is you're working with pregnant patients. And so if you're not, up to par with L&D, you have to get there.
Yeah.
uh, and so I've been doing a lot of that actually recently, a lot of pregnant patients. Oh, what else? I mean, that's, I guess, that in a nutshell. You do pass a lot of meds because you have a lot of patients.
Sure. And it's interesting when you think about like the primary care aspect of
Hmm.
it, because some of these people might not ever have seen a doctor, or it's been
Oh,
so
yes.
long, but you could maybe have, yeah, some impact on their health education, because in the outside world maybe they were not following up or things like that.
Oh, that is so common.
Yeah.
Um, and what's difficult is like you get these people stable and then they'll leave, and then it's like you're starting from square one when you see them a month later.
Yeah.
I've been there long enough now to see frequent flyers come through. It's like, oh, that guy's back again and again, and
Sure.
some people, it's like you know, they can't help it. They end up
Yeah.
in the legal system over and over again,
Right.
and that's okay because it is what it is. You just take care of them wherever they're at. But we definitely, I mean, you get these people that are like diabetics type 2 that have never seen an endocrinologist, or a patient that's 6 months pregnant and has had no OB follow up care.
Wow.
Um, I will say I've never seen so many teeth in my life up until recently. When you're working acute care, the last thing you care about is like the teeth,
Yeah.
because people aren't admitted for teeth issues. But naturally, oral health isn't the best in a jail, so you do a lot of oral care, a lot of broken teeth, gum infections, exposed nerves because of meth and poor oral health. Some people are homeless. Um, yeah, it's so much variety.
Yeah, and when you talk about the high acuity stuff, like someone
Hmm.
coming in with chest pain, are
Hmm.
you kind of triaging that yourself? Are you working with a team with a provider, or
Hmm.
what's your role in that?
Yeah, so because there's so few resources in the jail environment, like you're it. So you're the triage nurse, and you're determining what to do with this patient. So that's why it feels like an ER, urgent care, because these people either are walking in to the jail because they just got arrested, so you're figuring them out at that moment. You know nothing about them, or they've been in the jail and they start having these issues. And so usually you'll assess them in the pods, and we haven't really talked about pods yet, but like how jails are structured in their format.
Hmm.
You'll assess them in the room where their cells are, or you bring them down to the clinic. Um, and then our site has on-site providers. We also have remote providers if our on-site folks aren't there that day. My guess is some of the smaller jails don't have on-site help in terms of providers, so they use remote a lot, which was kind of reminiscent of some of the hospitals I worked at as a travel nurse, because they didn't have on-site pharmacists during some hours of the day,
Okay.
which was interesting. In acute care, you'd think you'd always have one. That's not always the case.
Yeah.
And so, yeah, then you make a decision at that point whether you keep them or you send them to a hospital with a squad car or ambulance.
Okay. And you've kind of touched on how many different parts of nursing you really could
Yes.
use. So I guess maybe how much experience would you recommend, or what type of
Yeah.
like inpatient setting would really set you up for
Oh,
success?
yeah. That's a great question. Well, I took 4 years away or off from nursing, and it was an adjustment coming back.
I'm sure.
I was like, oh my God, it was really rewiring my brain a little bit, because when you get back into the nursing mindset, it's just unique, right?
Yeah.
The clinical headspace. I'm really drawing on my acute care experience. Now we take, and I'm sure a lot of corrections take new grads. I would
Okay.
highly, highly recommend a person have some acute care experience. Now, I'm lucky because I've worked in acute care and in clinics, and so that perspective is really, and I've worked in specialty and primary care clinics,
Okay.
which is why I feel like my pathway as a nurse is so all over the place. But all of that experience is really coming in handy. Um, but the acute piece is handy because about 10% of the time I'm dealing with acute issues. And so I'm thinking ahead like, oh, I've seen this heart failure patient at the bedside before, or I've seen this detoxer because I've given them IV Loraz at the bedside before, that types of things. And so
Mhm.
not that you can't acquire that level of knowledge, foresight, or intuition if you're a new grad into corrections, but it's certainly helpful to have the acute side. Another piece that I don't really have is a ER, or like a rural critical access triage because you have so much autonomy in the jail setting.
Mhm.
In those low resource environments, you really have to be really confident in your triage and clinical, skills and mindset. And so having that piece could be really helpful as well when it comes to getting into corrections.
Okay. And then aside from the clinical experience,
Mhm.
are there any types of personality traits or things that you feel like, flexibility, whatever it may
Mhm.
be, that really set you up for success?
Yes. Um, this really goes with just about any setting, right? Like
Mhm.
being really sympathetic and understanding, setting aside the part of your brain that wants to judge people for their alleged crime, or assuming that people are, manipulating you to get an objective. Um, and so the jail is a challenging place, and so being really flexible. Um, Compassion goes a long way in a place like that. It's really easy. I could see a person getting jaded, just like any setting, I suppose, in healthcare. But I think corrections has that ability to. You're really at risk for that because of the types of people that you're working with. I get yelled at every day by angry people, and so my guess is that probably happens in the ER. Would you say a lot? Did you ever work at ER? Or?
I did more ICU, so not quite as
Okay.
much yelling
Okay.
here and there, but I
Yeah.
could I could definitely see that more in
Right.
the ER.
Yeah. And so, yeah. Yeah, I think that those traits would be helpful.
Yeah, being able to roll with it.
Mhm.
But yeah, taking a deep look inside and saying like, do I have the ability to care for everyone the same as I would care for, any patient in the hospital, really?
That's key. I really think because you're working with people that are have a criminal history or are currently in the legal process, you have to set that aside to um, take care of them effectively. You're taking care of a person, not a criminal.
Yeah, absolutely. What has really surprised you the most about the role, either good or bad? Have you had surprises?
I would say how this is going to seem simple, but how excited I am to go to work.
Yeah,
I haven't felt that way in a long time in a nursing position, and
that's
so
amazing.
I feel like it's every day I am surprised and entertained at what I hear. Unfortunately, because of HIPAA, we can't really chat about that on a podcast. But
Right.
just know that um, it is so funny the things that people. It's what's been most surprising is not so much of what I've seen; it's what people say and their
Yeah.
stories behind them. That's been the most surprising, and um, I just love that part. It keeps like I drive into work. I'm not dreading the next 8 hours of my life, and that sounds so bad, but I think a lot of nurses feel that way.
Yeah.
When they're burnt out, is they go then they're sitting in the parking lot just thinking to myself, "Shit, I'm about to do this for 12 hours. Oh my god." I mean, I don't know if you've ever felt that way, but
Yeah,
a lot of people
I
have.
think most nurses have felt that way in some sense, or
Mhm.
jobs, especially in the ICU. I think like leaving and knowing you're coming back to the same shit show you just left
Mhm.
is really something I think most of us have felt. And it's so awesome to hear that there are a ton of corrections nurses that just love it
Mhm.
and show up to work and don't dread it, because I think that's what we're all looking for.
Yeah, surprising that the corrections is the mecca of nursing. Who would have thought that that is a place you go, to
Yeah.
have true satisfaction? I mean, I'm just one person, right? But I've worked in a lot of places, and yeah, this is by far my favorite. And
Yeah.
this is not sponsored. I'm actually saying
Yeah. Absolutely. And yeah, you're not the first corrections nurse I've heard it from. I hear it from the few corrections nurses that I've talked to, that it can be a rewarding place to work, good work-life balance and things like that. Do you feel
Mhm.
like your work-life balance is great with
Oh,
this?
totally, totally. I mean, I have a very cush schedule. I have zero complaints. I guess I do miss 12s. I work 7 to 3 because I have a kiddo, so
Yeah.
I have to pick him up from daycare. But I do miss 12s because the 3 on 4 off deal, that was pretty slick.
Yeah.
But yeah, I have and yeah, what does that mean, work life balance? I don't even know at this point. But I would say that I feel good about like my arrangement with work. I don't love working 5 days a week, but if it means I get to take care of my family and pick up my son from daycare, I'm cool with that.
Yeah, and I think work-life balance, whatever it may mean, is like so different for every person,
Yes.
and it changes minute by minute, because what I wanted 1 year ago for work-life balance is different
Yes.
than what I need today.
Yes.
So, um, okay, how we always wrap these up is, if you were talking to a bedside nurse and
Hmm.
they're thinking this sounds like a really interesting possibility, what would be your advice to go forward from today if they were interested in, looking
Oh,
at corrections?
oh yeah, I would definitely not discount it. Um, I don't know if it's the best place to first stop in your nursing career. I think that the acute piece is really valuable before you go into corrections.
Mhm.
But I would definitely give it a shot, because I think you'll be pleasantly surprised at how satisfying the work is. And yeah, I think corrections is just really unknown. It's really mysterious. I wouldn't have found it. I felt like by luck. I found it in a Facebook group, and I chose to go back to nursing recently, and I'm just really glad that I got lucky and found it. And yeah, give it a shot. Um, my guess is uh, a lot of these places will have like a shadow experience. Like, yeah, if you're on the edge, you could probably shadow for half a day. I mean, I know we have nursing students that shadow nursing all day, so they follow them around. So you get like a taster
Yeah,
of
I
that.
feel like that would be exceptionally helpful when looking at
Yes,
a role like this, when you feel like
oh
you
yes.
really aren't quite sure what you're getting into.
Yeah, especially when you feel like your safety is on the line, like
Yeah.
physical safety.
Yeah.
Having the shadow experience would be helpful to ease that concern. And I think there are tons of corrections jobs out there, and so I think it's just the best time to get into it.
Yeah, absolutely. And I think, when I was looking at a job in corrections
Hmm.
and you're telling a great story, it's helpful to talk to somebody that's doing it and ask your questions.
Hmm.
And I found that when you reach out to people, like I've found LinkedIn to be the easiest way to do that, but everyone's super happy to, answer your questions, give you like the real details of what
Hmm.
it looks like day to day, what the challenges, perks are. So we try to bring that to a wide audience, but talk to a few more corrections nurses and, get a sample and see what you think about it.
Definitely.
Yeah.
Definitely.
Well, thank you, Andrew. I think I love this story because every nurse's path is so different. And really, what we talked about, caring for this vulnerable population, it
Hmm.
takes a special person, but it sounds like it can be such a rewarding role. So, thanks so much for sharing your story with us.
Absolutely. Thank you so much for having me.
And for our audience, if you want more spotlights, career deep dives, and practical advice for exploring your own non traditional path, make sure you're subscribed to our newsletter. So, thanks for joining us, and we'll see you next time.
See ya.